Thanks, Susan. Hi, I'm Mark Spikerman. I'm the Chief Information Officer of AmerisourceBergen, and it's great to have the opportunity to participate in the Foundation Conference this afternoon. My team is responsible for all the technology in the corporation, whether it's the massive systems that enable us to deliver drugs to 100,000 plus customers within 24 hours of ordering, or enabling new customer solutions for cell and gene therapy, or creating a next-minded digital workplace that allows our team members to be productive. That's what we do. And I'm really excited and honored to be joined here by Jason Friesen for the conversation today. Jason is a paramedic by training and also the founder and executive director of Trek Medics International, which is a non-governmental organization that is looking to improve access to emergency medical systems, also known as EMSs, for at-risk and vulnerable populations using innovative technology. Jason's been in EMS development and disaster response for nearly 20 years, which belies his youthful appearance, with extensive experience in the Americas, the Caribbean, and also Africa. He has his master's in public health from Columbia University, and also served as the country director for Project Hope in the aftermath of the 2010 Haiti earthquake, and is an active member of the U.S. National Disaster Management System. So, Jason, it's wonderful to have you here, and I would love if you just wouldn't take a few minutes and just share a bit more about Trek Medics and the work you've done with the AmerisourceBergen Foundation.
Yeah, thank you very much for the opportunity. It's really great to be here and to have the chance to talk about what we've been doing with the AmerisourceBergen Foundation. Over the past 18 months, we've been working together to improve access to life-saving care and medications for persons suffering from opioid overdoses. In particular, we've been working on programs in 5 different communities to implement community-based overdose response networks where street outreach workers, harm reduction organization members, or layperson bystanders equipped with naloxone are alerted when there's an active opioid overdose and are able to respond quickly in tandem or even before formal 911 responders to administer naloxone and to prevent a fatal overdose. Over the past 18 months, these responders in these different communities have responded to nearly 400 overdoses with an average response time of just over 5 minutes.
I mean, that's pretty amazing. I've got to just take one step back here. How did this happen? I mean, you clearly have a passion. You clearly started this. Why? Like, where did that come from?
Yeah, that's a great question. I used to work as a paramedic in San Diego, California, and this was back in the aughts. And before there was the opioid epidemic as we now know it. And back then, the only way you could get naloxone was if you called 911. Since then, naloxone has become available over the counter or through public health departments, harm reduction organizations, and it became apparent to me that, now you have these community responders or laypersons in the community who are carrying naloxone, but still the only way to get it when it's needed is by calling 911. So it kind of preempts the whole point of giving it to laypersons. So what we decided to do was find a way and work with different community organizations that in case there was somebody nearby the overdose who could get there quicker than 911, then they would be alerted at the same time. And so it was just a way to reduce response times because opioid overdoses is one of those medical emergencies where seconds truly matter. There are actually very few medical emergencies where it comes down to seconds, but opioid overdoses is certainly one of them. And we just wanted to create a better way to get help when it's needed more quickly.
I love that. It's just amazing. You saw a need, you saw a way to go solve that, and you jumped on it and said, let's go do this. And it sounds like Trek Medics is just a tremendous user, an innovator in using technology to solve this particular problem. And at AmerisourceBergen, we've definitely been focused on that as well, trying to focus on the changing needs of patient populations around the world. And at the core of our business is a belief that everyone deserves to be as healthy as possible. and that all deserve equitable access to healthcare. And that just seems to be such a really solid connection. And for us, we've pioneered a bunch of different areas of technology. Part of it's artificial intelligence, and so that's in our patient services, so we can improve the performance and reduce costs, so that all patients can get access to their medicine. And so there's some really nice connectivity there. Technology has also allowed us to be nimble in our business model and to meet the continually evolving challenges that come our way. But the last 18 months have been really wild. And I think we've all have just realized how flexible we have to be, and we've had to pivot and shift like never before. And so I can imagine that you've experienced the same thing. And so can you just talk for a little bit about what's changed for Trek Medics over the last 18 months, and have there been any silver linings for you or the organization?
Yeah, you're absolutely right. The last 18 months have been like we never expected. The cliches have been thrown around so much, but they are true. It has been unprecedented for us. At the very beginning of the pandemic, we had a surge in new users, and not with our traditional partners like EMS agencies or fire departments, but more with community-based organizations that were trying to be able to get resources and essential supplies to people who couldn't leave or didn't want to leave their houses because they were at higher risk of infection. And so we saw, for example, in Washington State and also in Minneapolis, groups using our software to create what we were calling resource delivery networks. And that happened, in the first wave in the spring of 2020, and then also into the summer. But then another huge thing happened here in the United States with the murder of George Floyd in the summer of 2020. We started getting a lot of interest from other types of community-based groups that were very eager in finding new ways to participate in 911 response. And this particularly was going on with groups that were responding to domestic violence, also to behavioral health emergencies, and of course to the opioids overdoses. So it was kind of like two tectonic shifts for us, where really kind of put for us in focus this really particular niche market of community-based organizations that were involved in emergency response, but didn't really know that they were also in the game of emergency dispatching. And as it goes right now, the only thing available on the market technology-wise are the dispatching systems used by formal 911 call centers, which are either too expensive or too much. They're too sophisticated for community-based organizations. So we really found ourselves in a uniquely advantageous place to be able to serve these groups, and it has been really heartening for us to be able to see all of this change going on and also have a chance to contribute positively to it.
Certainly, you've been rolling with the punches there, and then finding places to engage. And the thing that really resonates is this connection between how tightly integrated with the community you are, and then that use of technology to solve like a real problem. And there's places I think we can trade some notes, because as I listen to that, I think about for us, we're on the front lines, and we're proud to be on the front lines over the last 18 months. And for our teams, I'm just awed by our team members who have been super committed to delivering the highest quality service and fulfilling the needs of pharmacies, hospitals, and other healthcare facilities without missing a beat, despite all the challenges. And for us, we created we coined this hashtag Never Prouder early in the pandemic at AmerisourceBergen, and this has been like a hashtag Never Prouder moment for me. Watching how technology supported that work is certainly the highlight. And as I think about technology and how it's going to continue to play a pivotal role in these communities as we move towards recovery, how do you see technology playing a part in the recovery of communities in the coming years?
For us, the real big area of focus and where we see having the most potential for impact is definitely in the community-based model, especially in augmenting formal 911 responders. As a former paramedic that worked very much in a high-volume 911 system, it was apparent from the outset that we're being called to more emergencies than we're able to handle either in volume or in scope. And by that, I mean that when I was in paramedic school, we spent so much time talking about cardiac conditions and strokes, and traumatic injuries and kind of I guess you could say the big ticket medical emergencies. But then when we got out onto the ambulance, an extraordinary amount of our time was responding to mental health emergencies and also substance abuse problems. And we didn't have nearly as much training in that area. And so we were kind of ill-equipped, at least from an education and training point of view. And much of what we got was learned on the job. However, there are people in the community who are very well trained in behavioral health emergencies, in substance abuse counseling, peer counselors, crisis counselors. And we see that this model of engaging more community members in 911 response it has to go in this direction because the 911 system is overwhelmed by requests. So we really see that as a huge opportunity for growth and meaningful impact. I think in general, what you're seeing, a perfect example, as we speak, Hurricane Ida is, there are 1 million people in New Orleans and surrounding communities right now that don't have power. That includes the fire departments and the EMS services. And we have groups that are using our software to dispatch responders, community responders, to help people and really take a load off of the 911 system when power comes back online. They're going to be swamped with calls, and a lot of them are going to be less than acute emergencies. So if there are ways that community groups can help share that burden and allow the formal 911 responders to take care of the real acute emergencies that need, truly expert training and resources and supplies, that's a fantastic opportunity for us as well. And we're involved in that as we speak. So this community engagement model is where we see a lot of potential, not only in the United States, but in all of the countries we're operating.
Yeah, I can just, just sense your excitement and your passion for this. And as we discussed, it feels like so much of it is not because you read a book about being a paramedic or that you saw some really compelling, you lived this. And so you know firsthand what needs to happen. And you're able to connect up the need, that healthcare need, with that technology part of it. And that is just so close, and really the idea of meeting the healthcare needs of everyone is just spot on for us in terms of our alignment with our corporate and also the foundation's focus on health equity. And it's clear you're building another tool to help folks get the care they need when they need it in real time. And the part that just keeps on resonating with me is just how time sensitive what you're doing is. So if we broaden this a little bit, and so can you talk a bit about how you see technology and the improvement of mobile networks benefiting health equity in the longer term? So it's kind of that broader long-term lens.
Yeah, so that's a great point. Where we see the biggest opportunities for improvement comes in personal empowerment. There are people who have fantastic experience and training, but they are not included in the formal response system. So that's where we definitely see the greatest opportunity, but there are downsides too. And I think that we can all agree that there are a few companies that are swallowing up all of the other technology companies. And I actually see that as a real threat to this personal empowerment when everything gets centralized. One of the things that we see is there are a lot of ride-sharing apps out there, and there are these kind of crowdsourcing apps where the app company themselves control everything, right? If you want to use Uber or Lyft for medical response or any type of community response, they have to approve that. And frankly, from a business perspective, if it isn't going to help their business interests, then they're not going to approve it. And we see that as a real threat to these nascent community models and organizations that could do it. So our goal is really to be able to provide an opportunity or a technology where communities can decide these things for themselves and they can manage it themselves, and they don't have to really have an intermediary doing it for them. And I think that, the more you can put tools in people's hands to leverage their own resources and skills, the more useful they're going to be to these groups. And I think that that's just such an underrated area for growth, instead of having it concentrated in a couple companies, really giving the communities the tools they need to do it themselves.
That resonates a lot too. Part of our core business is enabling community healthcare, whether it's a community pharmacy, whether it's a community veterinary practice or physician office, saying, hey, you know what's best for your community. Let's give you the tools, let's give you the technology so that you can tailor it to the specific needs of your constituents. And so that really resonates really, really deeply. So I have one final question here, and this is the big one. So like, what's next? So when you think about Trek Medics in the future, what's coming next?
We've got such a fantastic and exciting program that just came online last month. We're working with Litchfield County, Connecticut, which is in northwestern, a rural county in Connecticut. And they've been using our software Beacon, the dispatching platform, to alert community responders about overdoses and to get them to hotspots to distribute naloxone to prevent more overdoses from happening. But this is stage one of a two-stage program, where the second stage is that we are going to be integrating with a fantastic application called OD Map, which really aggregates information from communities across the country to be able to alert community organizations when there are spikes in overdoses, so that they can mobilize resources and help to prevent that spike from spreading. And so we're working with ODMAP and Litchfield County to really automate the alerting process. So not only is Litchfield County going to be alerted when there are overdose spikes, but they're also going to be dispatched automatically. And, a lot of the things that happen these days with new technologies is there are all sorts of alerts going out. But the second part of that is, well, what do you do now? And that's what our software does, is it coordinates the response. So yes, here's an alert. We know people need help, but now how do we coordinate a response to that to get them the help they need? And that's where this integration with ODMAP is really going to, we think, create a lot of new opportunities for other organizations, other communities to be able to prevent these overdose spikes from growing and affecting and, taking the lives of other people prematurely.
Wow. You clearly have a great vision and are continuing to push forward to drive new services for the community, and the alignment between what you're doing, what we're doing, and also the foundation is really just so tight. And Jason, it's wonderful meeting with you. It's great to have you here. So thank you for joining us. Please keep on doing great work.
Thank you, Mark. Thanks for this opportunity. And thank you to everybody at AmerisourceBergen and the AmerisourceBergen Foundation for making this possible. I can tell you that we spent a lot of time not getting any support from anybody. AmerisourceBergen was one of the first to step up, and we're so grateful for it and grateful for all the great work that you are doing. So thank you for this opportunity.
And with that, I'll turn it back to you, Susan.